Behavior assessments included in the IEP. A behavior intervention plan lays out how the IEP team will improve difficult behavior that is inhibiting a child's academic success. If a child can't focus, doesn't complete work, disrupts the classroom, and is constantly in trouble, not only does the teacher have the problem, but the child has a problem. A behavior intervention plan is a document that describes just how the IEP team will help improve the child with his or her behavior. And this plan will then be included in the IEP that will follow the child throughout his academic career. Reliability of assessments. Reliability refers to the degree in which an assessment tool produces stable and consistent results. When an assessment provides stable and consistent measurement of student learning, it will give the same result, regardless of when the assessment occurs or who is administering it. We expect findings to be consistent regardless of when a measurement or evaluation is conducted. For example, an oral thermometer designed to measure body temperature must consistently and reliably measure a patient's temperature each time it is used. Similarly, if your test is reliable, then the same result should be obtained regardless of who administers the test. The greater the strength of the reliability associated with a measure, the more certainty will exist for the accuracy of the obtained findings and the subsequent decisions that are based on those results. Various factors can affect the reliability of a test. For example, the length of the test, number of students in a sample, and the students themselves. Stability, or retest reliability, is the consistency and stability of results or findings that are generated from a measure or procedure over repeated administrations. Alternate form reliability is utilized when two parallel or equivalent forms of a test are developed, such as Form A, Form B. I do that quite a bit in my classes to keep everybody honest, and it works, and I get the same results. Internal consistency reliability examines the uniformity of individual items within a test and their overall cohesion in measuring a particular concept. Rater reliability examines a consistency that is demonstrated between two or more raters who independently rate a demonstration or project. This happens quite a bit with my FBLA groups. When we give presentations on projects, we have two different types of raters, and we get some consistency between the two because they have a standard rubric. Validity of assessments. Validity refers to the accuracy of an assessment or how well it measures what it is supposed to measure. There must be a relationship between the task and the learning required to complete the task. For example, if you are constructing a quiz or chapter test covering material that has been taught, test items and questions that actually reflect taught material need to be used and should reflect both the range of the covered material as well as the practice skill set. Also, screening tests in kindergarten, foreign language, for example, as well as college entrance exams such as the SAT, identify current performance levels and examine the relationship of specific performance levels at or below grade level with a set criterion or potential for academic outcomes. There is a goal of being strong indicators of future academic success. The importance of reliable and valid measures for students with emotional and behavioral disorders. Since assessment and identification of children with emotional and behavioral disorders is complex, it should involve multiple assessments, strategies, and participants. When measuring a child's behavior, it is important to make sure that everyone collecting the data knows what to measure and what not to measure in order to ensure that the data is accurate and reliable. For data to be useful, it must be valid, accurate, and reliable. Validity exists when the assessment measures information relevant to the behaviors and or emotions being exhibited. The measurement is reliable when it gives the same results of the same area that is being observed and measured. Without measuring and evaluating with reliable and valid assessments, we would get inconsistent and invalid results. We would not know whether to change the program and strategies we are working on, when to add new goals, or when to change our procedures to make the greater progress. This could also lead to inconsistent identification of students altogether. Therefore, it is important that all of the assessment tools that we use during our evaluations of all students, especially those with emotional and behavioral disorders, are tested and proved to be valid and reliable.